Good morning, good afternoon, and good evening, social marketers around the world. My name is Win Morgan, and as president of the International Social Marketing Association, it's both my privilege and pleasure to introduce the 24th in a series of webinars designed to advance social marketing teaching, research, and practice. I'm here today with Jay Kassir, our moderator of our webinar, and of our webinar series, and chair of the ISMA Membership and Affiliations Committee of our Board of Directors, and Tamara Harbour, our organizer for today's webinar. Hi, Jay. Hi, Tamara.
Hi.
Hi, Tamara.
She's probably muted.
Well, she'll come out later, I'm sure. Well, we're going to begin our webinar in a minute, which is going to be a great webinar with Jose and Sanchez, talking about adding social marketing to health risk communications. But before we do, I'd just like to give you a couple of quick reminders. If you haven't already signed up for the World Social Marketing Conference, which will be held in the United States, 16th and 17th May, we really recommend that you do so. It's going to be huge, as our 45th president says. You can go to www.wsmconference.com and you can sign up there. We already have more than 350 people signed up, and we're looking to have a lot more coming in the next month. So do sign up for this conference. It's going to be great. Also, remember that we have a job board and an event calendar on our website, which is i-socialmarketing.org. The event calendar will show you events from around the world that you can go to. Some are free, some not so much, but you can always find out what's going on in the world of interest to social marketers around the world if you go to the ISMA event calendar. And also remember, we do have a job board as well. If you are an employer and you would like to use our job board to recruit social marketers from around the world, feel free to send an email to win@i-socialmarketing.org, and we will send you a coupon for up to 5 free job announcements. You're looking for a job? Upload your resume to the job board and see who bites. Now, I'd like to turn the webinar over to our organizer, Jay Kassir. Jay?
Thank you, Win. I'd like to start by just mentioning a few housekeeping items. If there's more than one of you at your location, we would appreciate it if you'd let us know how many you are using the chat box. And please do ask your questions using the text box as they come to you. Don't wait till the end of the talk. We'll answer your questions at the end of the talk in roughly the same order as they came in during the webinar. I have 2 quick polls for you as well here. The first one, how did you find out about this webinar? If you can just tell us that, please. Many of you, of course, hear about it in your emails that you get from us, but some of you will hear about it in a different way, so we would appreciate knowing that. And once you've submitted, you will be able to see, I believe, the results for everyone, and it's mostly by email. From SMANA, their emails as well, which is great. And the other, maybe whoever filled in the other could tell us what that other is so that we know what that means, please. I'd also like to find out where you're located. We had quite an interesting distribution, at least in registration for today's webinar. People from more countries than usual, which is nice to see. And so you'll see we've got people from Western Europe, Central, South America, North America. We will be getting Australia, New Zealand in the second webinar today. Okay, well, thank you very much. Then it's my pleasure at this point to turn it over to Tamara, who is going to introduce Jose, our speaker today.
Thank you, Jay. And it is my pleasure to welcome our speaker today. Jose Sanchez is coming to us today from Mexico. He is a brand and marketing manager with an MBA in International Marketing and Brand Management from Universidad Panamericana. He's been a social marketer since 2007, when he was part of the first generation of social marketers in Mexico who introduced social marketing theories and ideals into social programs around the country. Jose worked for 8 years within Mexico's Ministry of Health, and it's there that he was part of the Ministry of Health team generating strategies for dealing with the H1N1 influenza outbreak in 2009. He also presented the case to the World Health Organization Risk Communication Advisory Committee on behalf of the country, and today he's going to be talking to us about how to bring social marketing into risk communications, and I know we're really looking forward to hearing what you have to share with us today. So thank you very much for being here, Jose, and over to you.
Thank you, Tamara. Thank you, Kay. Thank you, Win. Well, let's talk about one of my specialties, that is social marketing in health risk communications. Hope you are doing okay, and let's start this. So, what's up for today? We will be giving a quick back to basics, a review of what is social marketing to be in the same page all. Also defining the risk communication in health perspective, also health risk perception. Also, we'll be talking about the platonic relationship between social marketing and health risk communication, how the both of them can contribute to a better emphasis on changed behaviors and how to reduce the risk on the population. And also, I will be talking about that case that Tamara mentioned I was involved. That is the case of the 2009, the influenza H1N1. So, let's start. This is a quick review of what is social marketing, reviewing the fundamentals. So, what's social marketing? You already know that. I just want to point out some quick ideas. You know that social marketing is from the 70s, the concept, and well, it's very, they have a little bit of changes. So, keep that. So, this is the point I want to talk about. So, social marketing for disaster management has been defined as the process of communicating a risk message to a target audience by learning their cultural identifiers and crafting a customized outreach approach that addresses their uniqueness. This is how? Well, by promoting distribution of ideas, services, to influence the target audience to accept, reject, modify, abandon a behavior. So, in other words, social marketing is equal to social good. That's right. So, types of campaigns, social marketing, okay, how we do it. You will need to understand the process of learning of your target group. And this is the part most interesting, learning. Learning is equal to education. Education is the starting point of all social marketing programs, as you already know that. Without it, just makes no sense of launching a social marketing campaign. It's blind. The actions will not take effect. First of all, the target must be the right mental tools to understand what they're trying to sell them. Also, you will need to introduce one step-by-step engineering awareness approach. And what's that? Well, Les Robinson in Social Change Media said, engineering awareness. When it comes to behavior change, there is a distinctly managerial habit to all this. We are all the managers. We have the true knowledge and correct behavior. They, the target audience, don't have it. If we can inject our knowledge into the passive audience, they will realize the error of their ways and start behaving correctly. So, it's widespread, especially among engineers and managers, that is based on the assumption that awareness building is the key to behavior change, right? But how is social marketing applied to risk communication? Let's see. We'll be right now very quickly health risk communication and health risk perception to understand the basis of these concepts. First of all, risk communication, a relatively new communication model, is a complex, multidimensional, evolving approach to communicating with the public about issues that pose a threat to health, safety, or environment. However, risk communication is more than simply disseminating risk information. So, it's the exchange of information regarding the communicator and the audience regarding the significance, magnitude, and or control of health-related risk. The goal, always, as a communicator, may be to inform, to engage people in the decision-making process regarding a health risk through a two-way process, or to influence or to change behavior. Change a behavior. Very unfamiliar as a social marketer, right? Content Vicente Coelho. Only with trust having established can other goals such as education and concept building be achieved. Trust can only be built over the time and in the result of ongoing actions, listening, and communication skills. So, based on the 7 cardinal rules of risk communication by Vicente Coelho, the number 1 is accept and involve the public affect as legitimate partner. Second, plan it carefully and evaluate your efforts. Listen to the public specific concerns, and that's very important. And the second one that I have so much trouble back then when I was working with the Ministry of Health, be honest, frank and open, no politics. That's a big issue to manage. Coordinate and collaborate with other credible sources. Meet the needs of the media. They will attack you every time. Speak freely and with compassion. Simple and clean. That's my motto. So, the rules of health risk communication, what are they? In risk communication, there are 4 characteristics that the 6 spokespeople exhibit in establishing and maintaining trust. First, honesty and openness. Caring and empathy. Dedication and commitment. And competence and expertise. They are not in order, just they to stay always in the mind of the communication spokesperson or the one that is trying to make a campaign in risk communication. Here's an example of how risk communication works. This is the PAHO model of 2010. As you can see in this chart, sometimes when the first case enters, there's some period of time when really it's making a big impact in health issues or other things, but it's making a big of noise. We start to making a risk, and usually we start a campaign here at the last part. So we usually, as risk communication part, we have to start right off the bat. The first time they have the early detection, any big early response, we have to be a proactive communication of real or potential risks. And how's that? Sometimes it's preparation. Sometimes we have to be very aware of how are the risks right now in the country or the people. The risks always change, so we have to be aware of that. As you already know that, or you can perceive that, the norm is that usually in risk communications, all things start to explode. The media ask like 20 more times, demand us information, the public risks start to explode, and so on. There's a emergency communication demand, usually, each time. So, what's the health risk communication in other words? It helps at-risk populations make informed decisions based on information, encourage protective behaviors, complement existing surveillance systems, coordinates health and non-health partners. It's very important. All the population is involved. Minimize the social and economic disruption. It maintains control. Builds trust, required to prepare for and to respond and recover from serious public health. And that's, as you can see at the beginning, with these characteristics, we can achieve that, the trust of the population, to believe in us and to make that change. So, risk perception also significantly affects risk communication. First and foremost is the idea that perceptions equals reality. And in marketing, commercial marketing, perception is reality, yes. It's like a rule for all of us. People view risk differently for different reasons. We have a lot of target groups to be aware of that. Researchers have identified several common factors that influence risk perceptions. These factors are varied and have significant impact of how strongly risks are perceived. For example, risks that are perceived to be familiar, voluntary, natural, or under individual controls are more accepted than risks perceived to be unfamiliar, involuntary, or exotic. Here's an example. Lower perceived risk. Voluntary is like smoking. I know that I smoke, I know that it's a risk, but I take it because it's voluntary. Domestic, Lyme disease. Random, terrorism, maybe it happened, maybe not. Familial, very, very aware of that, is household dust. Natural origin, it's random. Higher perceived risk that people really is aware of that and know that is very risky for his health. Voluntary, second-hand smoke. I don't want to be a person with smoking because it affects me and it's really, really strong in me. Exotic, West Nile virus. Direct, like September 11. Unfamiliar, the World Trade Center fall dust. Or the human origin, nuclear radiation. This all can be perceived like higher risk, and the people know that in the start. In his book, Paul Slovic reports that usually vivid or memorable hazards receive extensive media coverage, may distort perception of risk. The Chernobyl and the 3 Mile Island nuclear accidents are example of how extensive media coverage led to an unprecedented worldwide fear of nuclear power. So media is very powerful indeed. Conclusion for this concept of health risk communication. Risk communication is effective at addressing the complexity of fear, outrage, mistrust, and uncertainty. It's where emotions are part of it. Therefore, it's the ideal of addressing various public health issues caused by toxic chemical pills, contaminated drinking water, or hazardous waste. Risk communication is also being applied to address emerging public health threats such as outbreaks, influenza virus, or mad cow disease. So, it's a little parenthesis. The core capacities of risk communication for public health emergencies that we talked about back then when I was in the Global Health Security Communication in Lyon, France, and it's 2009, was transparency at first announcement of real potential risk. Be sincere to the public. Be very clean of your message. Public communication coordination. We don't want to have one person of any kind of job in the government to speak on the things. The health minister say other things, and the president say other things. We have to have everyone in the same page. Information dissemination includes media relations. Listening through dialogue. You have to establish a constant ongoing communication with the public, with the media, to be in the same role. Emergency plan, communication plan. It's very important to have an emergency communication plan just before any kind of risk perception or problem that is coming, or maybe it's not coming, but it's have some percentage is maybe coming. So here we are. So the platonic relationship between social marketing and health risk communication. Social marketing for disaster management, we have been defined at the beginning of this presentation, is a process for communication and risk message to target audience by learning the cultural identifiers and crafting a customized outreach approach that address their needs. So, the effective risk communication uses the journalist rules of who, what, when, where, why, and how to define his/her target community. Once the community is defined, it is necessary to ascertain the demographics, political environment, and culture to complete the profile. Within the public health, there is a broad acceptance of the value of the application of social marketing to change behavior. Yet there is no formal integration of social marketing with communication for purpose of strategic pandemic communication. As you can see, you can log to the WHO website, you will see only risk communication, but barely you can see any component of social marketing. This raises the question, if one were going to integrate social marketing with risk communication, what will the process of relationship between the two look like? Through literature review, the value of risk communication and its application in crisis, including a pandemic, were emphasized. The social marketing literature focused on the core definition and principle underlying behavior change communication. It's the same about, but let's see. Here's the common ground for health risk communication and social marketing. First, formative research is the best, no? You have to start with that. Social psychology approach, anticipating behavior, and that's really the part of social marketing. To be with the public every time to see how they perceive some kind of risk and how you can anticipate that behavior. Also, seeking behavioral change. How can they change a conduct over a risk communication process? Finding pathways to communicate. That's very important. Maybe not all the channels are the right ones, or maybe they. You have very different audience that maybe some audience can see television or radio. You have to be in there because they don't have the resources for that. You have to be aware of that. So the best of two worlds. Social marketing could be used in more systematic way to prepare the public for a pandemic and to strengthen the risk communication message development process for pandemic management. The more systematic use of social marketing audience research to clarify and maximize the risk communication message developed should be explored. And that's right. Any questions? You can ask anything, anytime. So, let's see. All this theory, okay?
Sorry,
okay.
Are you opening up for questions at this point then?
No, I just want to ask you if they want to ask questions about the theory.
Oh, okay.
Okay, let's continue. So we'll talk about this important case, and maybe you can identify with that. This case is about the influenza H1N1 outbreak in Mexico of 2009. Some background story. Mexico, since 2003, had developed a national preparedness and response plan for influenza pandemic focused in risk communication, health promotion, and it's not social marketing, health promotion, healthcare, epidemic surveillance, strategic stockpile, and research and development. The new social marketing program or component was very difficult to identify in that moment how it was the Department of Social Marketing involved, was inside health promotion in 2007. Okay, so as you can guess, this plan was changed on April 2009, where a new type of influenza, this one, referred to as swine origin, was detected in Mexico. The problem is that this plan was like a shield if that influenza or that outbreak comes from the U.S. or from the south of the border, but not was developed in Mexico. That was a big issue to change everything. So, the decision and actions taken to control for the first epidemic wave in the country. It was like hell. Run every time and change everything, but it was worth it. The international community will be able to use the Mexican experience, the Institute of Rural Health. You can search on WHO. We have a document, and it's all documents here. So, let's review what happened. In early April, an atypical situation in the behavior of acute respiratory tract infection was seen in Mexico. Usually we have a stational influenza in the last part of the year, in January, maybe February, but it was very strange that it was coming in April. So, the fact that young adults were the affected age group, together with the isolation of influenza A virus that could not be typed in the reference laboratory, was striking at the moment. On April 24, the President of the Republic issued a decree empowering the Federal Ministry of Health to coordinate the public, private, and social settings to comply with the national ordinance concerning various and general actions aimed to preventing, controlling, and fighting the resistance and transmission to resin detecting influenza H1N1 virus. So, we have a risk communication plan in the process, but how social marketing can help to change the effects of the population. So, an effective communication plan was established targeted to general population, healthcare workers, and information media. In its early stages, social marketing has added the mix supporting research of needs, fears of the population for a more emphatic message around activities for all health promotion. So, this is like the inclusion of social marketing risk communication plans in a graphic. We have incomes. We have that National Preparedness and Response Plan for Influenza Pandemic. We have epidemiologic information, scientific evidence. It was a new type of virus. We have international guides that supports maybe our actions, information, data from our media that was very, very strong with us and very strong with what happened in the streets. Also facts, international facts around the world. And we established a call center for feedback. So, the social marketing component was inside the risk communication criteria and then inside the key messages. So, at the end, we have a lot of products that at that time was very risky because of the time, but we have a good response of that. So social marketing collateral materials in health promotion. I will show you then some examples. Some guidelines for different environments, maybe for transports, for travelers, and workshop for communities. And that's very important because it happened in Mexico City, but as you can know, Mexico City is a lot of Mexicos. Because Mexico with rich people, with medium income, and with very poor people that don't have access to anything. So we can We have a lot of target groups involved. So data gathering. The instrument used to know the perception of risk of our target groups. First of all, monitoring analysis of radio and television programs with open lines for consultation with experts. Daily analysis of the most frequent asked questions in the telephone answer center. Analysis of perception surveys carried out by different companies and media communications, specialized in health issues. Daily analysis of main messages in print media, like our blog about influenza. It was launched in that time. This influence on influenza was very specific. So, key message development. The objectives of the strategy were to define the information needs of target groups and specific information. To create message badges on those needs were created in alignment with available scientific evidence, and to respond immediately to the epidemic as it was beginning lived day by day. Each day we have an epidemic review of how it happened in Mexico, so we have to change maybe the message if the public is not responsive for a particular idea. So with this information, it was very constant and very dynamic. That's what I was looking for. So the content of this message includes information about what is influenza, the common basic, so people understand what is this risk and how they need to perceive it. These virus characteristics, symptoms, and warning signs. The preventive measures to take care of. Reduction of social density. As you may be heard, one of those days, I remember it was on Friday, the president of Mexico told that anyone can leave their home in a weekend because it's very risky for the persons to be in the streets with this kind of virus. So commerce is all commerce is closed, banks are closed, schools are closed. Everyone is in the house because of this risk. Recommendations for different environments like workplaces, I already said that, transport, and so on. So here's the big picture of the planning design of the marketing special products. What were our target groups? General population, spokespersons, and communications, health professionals, personnel, hospitals, always, parents, kids also, travelers, workers, and decision makers. About surroundings. Well, we target living places, schools, health centers, restaurants, public transports, and meeting centers. The materials, we have a lot of them. We have 60 different types of print materials, decals, posters, triptychs, latch, educational games, TV spots, radio scripts, guides, and questionnaires. So, we have a specific action between social marketing and risk communication process. The first of all, an example is to reduce the infection. How? Well, we have in houses, living places, clean surroundings, clothes, staying at homes. One of the most important messages around this campaign was wash your hands. It's in action. Cover correctly your sneeze. Some people cover with the hands, and it's kind of infection, shaking hands. People in Mexico are used to speak in public. Not all, but they spit. It's very bad, but they do. So it was part of trying to lower the risk with that social behavior. This, as you can see, maybe not so clear, is one of the posters that we develop. Is wash your hands before and after, different situations. When you sneeze, when you throw out trash, when you're in transport, in a meeting, and etc. Promi. Promi was a kind of mascot that we use in these materials to be like very friendly to the public, and I mean to the more risky people, the people that live outside the city or maybe in some isolated areas. Also with the kids, to be a kind of friendly, and we have a good response with this image. Some other examples. Tips for cold season. This one was just after the influenza that we start to develop to lower the risk of infection. It was during the epidemic, so different kinds or styles of greetings without using your hands. We try to focus on low exposure, low density, and social distancing. This is, do you know how to wash your hands? The common 6 steps, international guideline, mention that. Just after the outbreak, we developed this kind of materials they don't let your guard down. To remember the key messages, the change of behavior that they need to lower the risk. Information for travelers, that's what's inside airports. And so on. So, evaluation. Tahoe and the General Directorate of Health Promotion in Mexico, so the agency specialized in research and quality evaluation, carried out a study in the month of May of 2009 to explore the perception and risk of the influenza epidemic between the population and the application of measures established by the Ministry of Health. This study was applied to men and women between 50 and 75 years of age, inhabitants of the Federal District and the State of Mexico. These were the principal findings. In general, basic prevention measures are no wash your hands, stay home, don't greet with your hands, and so on. But the frequent hand washing as the most recognized, however, are not carried according to recommended technique. They wash your hands, but not in the precise way. The proper technique for covering your nose and mouth when coughing or sneezing was not considered by the population as priority prevention measure. The face mask is a measure not by all, but in most cases is not used or is disposed correctly. In general, the population is well aware of the recommended prevention measures because the media were responsible for constant disseminating them. The major restaurants carry out the hygiene measure established. Transportation system apply more hygienic measures, namely the metro and metrobus. So the most used prevention measures, this was evaluation in June of that year. The first measure was always the frequent hand washing. The second measure was the use of face mask. And the third measure is not to greet with hands or kiss. In Mexico City and the State of Mexico, spontaneously mention the measures that are most used. first, vertical hand washing, like I mentioned, followed by use of the masking, and done with your hands. After hand washing, the most other mentioned were to cover your mouth when coughing, and in case of Mexico City, keep clean spaces and objects of common use. In the state of Mexico, other important measure is to avoid crowded places. So this, as you can see here, this is the percentage of one or more spontaneous measures according to the order of appearance. So as you can see, frequent hand washing was the best, that they stay in the top of mind of their heads of the population. So the outcomes. As you can see the dates. Not very clear. I hope they can see that. Is it in days? Starting on May 2 of 2009 to June. You can see the tendency of the trends in the media about influenza. So this is like the picture of how they develop the plan of marketing and social risk communication with the media, and also with the population, and also with the actions that take place with the Ministry of Health, like social dissemination and also vaccines and so on. So the news, it was the trend to go below on the mentions of television and radio and all kind of media. This is just how in our portal of health promotion, people were asking information about influenza. And you can see it goes lower and lower, like sometimes it stabilizes about. So social marketing, we need risk communication. It's learning from the past and getting ready for the future. Mexico lived a similar experience before the outbreak of an influenza virus. Planning and early time in decision-making contain dissemination of a virus among the population. Risk communication play a strategic role in protecting Mexicans and help to reduce the anxiety and uncertainty generated by this alert. So, the new introduced social marketing theories help to relate the key message with the research of legal specific behaviors within the public or private institutions as well by society as a whole. It's like the big picture of how happened these things in Mexico. You can see face masks were seen everywhere. So in conclusion, developers of social marketing campaigns within the risk communication process will face a number of challenges, including the need to raise awareness and concerns about the pandemic and influenza to a level that motivates consumers to respond, but not to a level that causes public panic. That's very important, the control of the message. Social marketing could be used in a more systematic way to prepare for an outbreak and to strengthen the risk of communication message develop process for a pandemic management. Social marketing plays a big role, and maybe it takes the lead for a change of behavior process. The role of emotion is fundamental to take on. Risk perception is driven by specific emotions like fear, anger, and guilt. We have to be aware of that. But risk perception and emotion create a process of certainty, control, and responsibility. Emotional appeals can be used to intentionally affect risk perception, but they have to be used in the correct context with the correct audience in the correct way, equals social marketing task. So my take on this one. Social marketing is an essential element that could help to stage for effective risk communication by moving the public to a different state of mind about behaviors necessary during a situational risk. So, I have in time.
That's great. Thank you, Jose. And we do have time for questions, and there's a number of questions that have come in, so let's get right to them. I'd like to start off with, there's a common thread with a number of them. I'll mention those. One being, where did it go? Yes. Could you talk about the process of getting the Ministry of Health to initially adopt a social marketing approach? And what is the current state of the field in Mexico? Now that relates to another question, which is, have you faced opposition from government officials for using the term marketing or using marketing concepts? And perhaps a related question, what is the key to convincing risk managers that they will benefit from having a social marketer on their team?
Yeah. I have to take a minute. At the first of time, I will talk about my experience with the Ministry of Health at that time, because as you can see, social marketing was new at the time, and the component was new, and the risk communication program was already established. But everyone knows about the risk communication process. The most common challenges is to make everything knows that social marketing can be very useful in a process that was already there, but with other eyes. That's risk communication. At the end, it was very difficult to be always in the same page. The social marketing component was very seen like, oh, social marketing is design. Social marketing, they will bring some new designs, posters to look prettier, and it was not that. It was very common to see the Ministry of Health in meetings say, okay, social marketing, please make a poster that looks great with the great key messages, but was all about design. So at the beginning it was very difficult to say, hey, it's not about the design, it's about the message, how you survey the people, you get all these pieces together to make a change, and not always keep inform people or say, do that or do this. You have to be aware that you have the information, the incomes for the people. You have to hear them and then make the change.
So
it was very difficult.
What convinced Mexico to make that change, Jose? That's Nidra's question.
It's more
had that
like
mindset.
Yeah, it was very difficult for in that part. It was very tricky at the beginning. We at the Department of Social Marketing, we helped the part of communication in the Ministry of Health to change a little bit, but not directly to the Ministry of Health. I can explain this different way. We developed a plan of social marketing with key messages on behalf of the communication program. These key messages they have all the social marketing components, but at the end, it was presented like a risk communication program. So at the beginning, it's like a curve, go around your enemy and make it different.
But how did you get in there to be able to do that curve in the first place? How did you get involved?
Well, that was advocacy with different directors of different institutions, health promotion, and also the part of epidemic diseases. We talk about it, and we make that change to the communication programs.
Okay, so it was a conversation with the people who were organizing the program, and they were receptive.
Yeah, at the first time, it was not very easy, but presented evidence, international evidence of social marketing in this kind of risk communication was the best idea, and they perceived like, okay, if they do that international, and also one of the big challenges is the time. Yeah, we are in the process of, we have an abrupt outbreak, so we have to take decisions quickly. So with the time, with us keeping this, we cannot, we cannot delay some decisions. So some directorates take that clearly, and they accept to take the challenge
And
to
did you
involve
get
social marketing in the program.
did you get people who were concerned about the fact that you were using social marketing, or did they even know? Most people.
Most people know about social marketing in Ministry of Health, and they know that social marketing is making something inside this communication process.
They don't mind the word
program,
marketing in there. They don't find that offensive?
Some of the people, yes. Because if you can see how is the Ministry of Health organized, they rely always in their communicational people. It's very institutional. They always send a message that the President said or the Ministry of Health said, but not inside the health promotion team.
Okay.
That's very difficult, but at the end was the instruction directly from the Ministry of Health that social marketing needs to be on this ship, supporting.
Fast forwarding now to 2017, the second part of Nidra's question. What's the current state of the field in Mexico? Are they much more receptive to it now that you've shown how useful it can be? Well, do people, is it still an odd thing to do?
Yeah, it's very sad to me to say that, but it's still perceived like social marketing is the department that is designing and making things prettier, but not is the one that research things.
Yeah.
So it was a very good at that time that we can achieve and have evidence of the social marketing components that was okay inside that communication process. But at the end, in this year, I can see that it's still in that part that social marketing in public health is still seen like the Department of Design, make things prettier or make things understandable for the public, but not that the panacea, that the starting point for all communicational programs.
Yeah. Okay. Well, that is a common issue that is faced in many exercises or programs. Let me go on because otherwise we won't get to the other questions. Two questions that kind of relate to each other. There's one from Catherine Sadler, and I think she's talking about the target groups. And I think her comment was that the initial list that you had seemed to be somewhat reactionary, and I'm not exactly sure what she means by that, but I guess she's saying maybe not strategic. How did you choose those? And I think she was concerned about addressing health disparities, which I started hearing you talk about when you talked about targeting your communication.
Yeah, different.
So you started looking at people who were in underserved or neighborhoods where it was more needed. So maybe you can talk a little bit about that. That relates to Tally's question. How did you determine the target groups?
Yeah. We are, as already told, we have already a plan for this the pandemic situation. In that plan, we have also a list of different types of target groups that was already determined. But as Catherine Sanchez says, it was reactionary. Yes, it was very reactionary because social marketing was new. It was some target groups already established by risk communication department. But we have to be very aware that the time was consuming us. So we take the decision to target that specific groups with information from a program that was already developed, and also with the need to target the most populations or most density of populations in Mexico City and the state of Mexico that was representative in this kind of outbreak. So we determined with the epidemic info and also with the information of different communities and different parts of the health of ministry that determine that these target groups must be attacked. These target groups they are the kind of like 80% of the population are these target groups, so please be aware of that. So with that kind of information, we determined in a couple of days. We don't have very much time to end, okay, this target group will be attacking, and we go on with these programs and with this, sorry, I missed the word, with other kind of materials.
Okay.
So it was very quickly.
Thank you. I'd like to put in, if we can, I don't know if you can answer this in like 30 seconds. There's just one last question, and then we've got to close out. How did you, what sort of thinking went around developing the 4 Ps of the marketing mix that you had?
Well, it was very quickly. We have the different kind of programs, different kind of groups. So the 4 kinds of Ps in the marketing mix was developed very quickly by different marketeers at that time. First, the public. We have a real-time public. The products we have, and how the promotion was very quick at that time. I don't know if that answers that question.
That may be all that we can get that in the time we have right now. And I think we're going to have to keep on going. But perhaps if you have an answer that's more fulsome, you can give it to us and we can send it to the participants, and in particular Callie. So from there, I think we'll need to move out, or else we won't end on time, which we'd like to do. I'd like to quickly remind you to fill out the evaluation on the way out so that we do know what we're doing well and what needs to be improved. Next up is cognitive neuroscience and behavioral economics, new tools to solve tough social problems, with Biju Dominique from India. On April, it doesn't say right here, but it's up on the 5th. Say again? 18th. Thank you, Win. It's up on the website. You can now register on our webinar page. So thank you to you, Jose, for your talk, and thank you also, Win, for making the webinar such an important part of ISMA's offerings. It's always a pleasure to do them with you. Back over to you.
Well, thank you, Jay. It's been a pleasure to be part of the webinar today, and you and Tamara, you make it seem easy. I know you're spending a lot of time in the background organizing the programs, and we know you're volunteers, and we really appreciate the work that you're putting into this. Well, Jose, hey, thank you for your presentation today on adding social marketing to health risk communications. It was a great and very timely look at what happens when you're trying to bring social marketing into a country, promote it, and use it. So we really appreciate your sharing your experience with us. I hope we can have you back for another webinar in our future webinar series.
Thank you, Wayne. Thank you so much. I hope that was very understandable for my part.
It was great, thanks. And to our members and our participants today in today's webinar, we want to thank you for your continued support and your participation. And look, we hope to see you at the next webinar in April 18th. That's what Cognitive Neuroscience and Behavioral Economics, New Tools to Solve Social Problems. Look at that, not even social marketing in the title. So that's going to be a good one. That's going to be great. Until then, keep visiting the ISMA website. Share your events on our calendar, exchange resources, keep up with our Career Center, and make sure to encourage all of your friends and colleagues to join the local organization or association in your area and continue to be a supporter of ISMA. Until then, this is the International Social Marketing Association, and we now conclude today's webinar.